Your health insurance is an important tool in creating a healthy life, and to use it to its fullest potential, you need to understand the basics behind your benefits, which many Americans unfortunately don't. Approximately 77% of Americans are confused by health terms, and 26% have avoided care or treatment because they were unsure of what their insurance covered. Today we're going to talk through everything you need to know about your health insurance, including what it is and why you need it, how to use it, where you can get it, when you can enroll, and more. Health insurance helps you pay for medical care when you have an illness, injury, or when you seek preventive services to stay healthy. Most plans help you pay for services like preventive care, hospitalizations, prescription drugs, vaccinations, lab work, primary care, specialist visits, and more. Essentially, health insurance is your connection to the care and services you need to get and stay healthy for any and every phase of life. Whether you're young or old, have few care needs, or have a chronic condition, health insurance is important. Without it, routine services and serious health issues can become very expensive. If you want to have access to the health care you need health insurance. So now that you know what health insurance is and why you need it, let's talk about how to use it. Health insurance works by splitting the cost of health care between an individual and the insurer to pay the provider. Prior to receiving health care, you will show proof of insurance to your provider, which is typically an ID card. This will tell them what kind of coverage you have and how to bill or charge you for your visit. Now that you know how to use your coverage, let's define some important terms you need to know regarding the cost of health insurance and how you and your insurer pay for care. The first financial term you need to know is premium. Premium is the amount you pay each month for your health insurance coverage, even if you don't use it. Think of it as your monthly bill for your health insurance, similar to a monthly payment for car insurance. Your premium amount is determined by several factors, which include age, location, tobacco use, your dependents, and your plan category. Next, you need to know the definition of a copayment. A copayment, or copay, is the fixed amount that you usually pay at the time of medical service. It's important to note, some plans may not have a copay. Your copay can vary depending on the type of service you receive. For example, a copayment for seeing a specialist may be more than a copayment for a visit with your primary care provider or PCP. A PCP could be a doctor, physician's assistant, or a nurse practitioner. Okay, now let's talk about your deductible. A deductible is the amount you pay for medical costs before your health insurance begins to help make payments to providers for services. For example, if your deductible is $1,000, your plan begins to help you pay once you have met your $1,000 deductible. The next term you need to know is coinsurance. This is the percentage of the costs you are responsible to pay. Once you meet your deductible, your insurance begins to pay a portion of your in-network visits. The exact percentages depend on your provider and plan. It could be that you pay 20% and the insurance company pays 80%, or it could be that your health plan pays 100% of coinsurance once the deductible is met. Finally, let's discuss what out-of-pocket maximum means. An out-of-pocket maximum is the set amount you pay before your insurance covers 100% of any further eligible healthcare expenses. If you or a family member have larger than normal health expenses and you reach your out-of-pocket maximum for the calendar year, your insurance will cover you at 100% for the rest of that year. For example, if your out-of-pocket maximum is $3,000, when you reach this amount, your insurance will cover everything else at 100%. Now let's talk about the three main ways you can get health insurance coverage. An employee-sponsored plan can be obtained through your employer or your partner's employer. Individual plans are available to everyone through the government marketplace or through a privately owned health insurance company like Arkansas Blue Cross and Blue Shield. Many people also receive health insurance through the government programs Medicare and Medicaid. Through any of these sources, parents or guardians can have children or dependents under the age of 26 on their health plan. Now that we've answered how and where you can get insurance, the natural next question is when. Once a year, you'll have the opportunity to select a health insurance plan during what's called an open enrollment period, or annual election period for Medicare. The open enrollment period can occur any time of the year, depending on where you get your insurance, but it will typically be at the end of the calendar year. For Medicare's annual election period, you choose your plan between October 15th through December 7th. You can enroll outside of the open enrollment period if you experience what is called a qualifying life event, which includes situations such as changing marital status, starting work with a new employer, losing other health coverage, moving to a new state, having a child or adding a dependent, or qualifying for Medicaid or the Children's Health Insurance Program. Now let's talk about one of the most important aspects of your coverage, your network. A network is a group of doctors, hospitals, and other healthcare professionals who have agreed to provide medical services to members of a healthcare plan for a certain price. When seeking care, choosing an in-network provider will give you a more cost-effective option than an out-of-network provider. Arkansas Blue Cross and Blue Shield has a comprehensive statewide network to ensure strong coverage for you while making sure every medical provider and facility agrees to certain discounts that make care more affordable for you. Now let's talk about the different types of health plans: health maintenance organization, preferred provider organization, point of service, high deductible health plan. With a health maintenance organization plan, you choose a PCP who coordinates your care using doctors and hospitals that are in your plan's network. If you need a specialist, such as a cardiologist, a referral from your PCP is required. This plan will usually have a lower monthly premium and deductible, but include coinsurance and copays. A preferred provider organization plan allows you to manage your own care with or without referrals from a PCP. You have a choice in which provider to see, although you'll save money if you remain in-network. It will likely have higher premiums than other types of plans, but lower copays and coinsurance. A point-of-service plan is a combination of the two. You can choose a PCP, but you can also get medical care from both in- or out-of-network providers, though you will still likely pay less by staying in-network. This plan may require you to pay a higher premium and have copays, but most have no deductible for in-network services referred by your PCP. The high deductible health plan gives you the most control on how your healthcare dollars are spent. It has a higher deductible, but a lower monthly premium and a special health savings account, or HSA, to save money on healthcare expenses. We've covered a lot of ground today. And now that you know a little more about the basics of health insurance, take the next step in your healthcare journey. Find a primary care provider and schedule an annual wellness exam. The Cross and Shield also cover Health Advantage members, as well as health plans utilizing Blue Advantage Administrators of Arkansas. Always check with your benefits administrator to ensure coverage and in-network providers. If you have a plan with us, you can register for Blueprint Portal to access that information 24/7.